Hello, everybody. Welcome to Ask Doc Live. Hope everybody's having a fabulous day so far. It is a beautiful Friday here in the United States Pacific time zone. We are still morning wherever you are. I am just so thankful that you are here with us, taking time, investing time in yourself, in those that you love, in finding information that is empowering, that you can do right from the comfort of wherever you are, whether it's your home, your office, does not matter, vacation, stuck at home. It's not stuck. It's all in the mindset, everybody. But we are empowered individuals, and you are here tuning in with us on Ask Doc Live. My name is Rebecca Dukes-Kozak, and I will be your host for the next 2 hours, where we are presenting information that, like I said, is empowering. So many people are sick and tired of feeling sick and tired. And folks, you're not going to hear the information that you hear today from most people in a white coat in a big old building. You are here in the comfort of your own home, wherever you are able to just plug into and receiving information that will actually work at the cellular level in helping your body do what it was divinely designed to do. Now, if you are here live with us today, we do have a chat function. We encourage you to turn that on, as our amazing co-hosts, Ruth Ellen Sanchez, Nasima Omar, Heather Bowen, Dr. Judy Reynolds, will be putting information into that chat that'll help you find the products that we are talking about today. But most importantly, if you were invited by somebody specific, if you have questions and want to get started on what our amazing doctor is presenting today, make sure that you get back with them. They took the time and they cared enough to make sure that you got plugged in to receiving this information so that you can actually make a U-turn in many cases on your health journey. Now, this program is being sponsored by Ask Doc Live. So if you are part of our newsletter, whether it's Ask Doc Live newsletter, Critical Health newsletter, and you are not referred to this program by anybody specific that you personally know, and you're here by invitation from an email you received, we welcome you to go to askdoclive.com to get the products that you need. We do have a contact us function there that you can use in order to have one of our certified holistic health coaches get in contact with you to make sure that you get the products specifically to meet your needs. But we also have a store there. This store has many of the products, and it has many of the books that Dr. Wallach has written in regards to the information you need to give your body what it needs. So people, there's so much information out on the internet. Don't know what works, what doesn't work. I am a testimony rather, as to somebody that has tried so many different options. But when I found what Dr. Wallach is talking about today, I felt the difference. And I went from getting sicker and sicker to now feeling fabulous in my 50s, better than I did in my 20s. I can't but tell and share. So the content of this program is to provide educational information only on the importance of nutrition and supplementation. Food supplies around the world are empty and void of the nutrition that the body actually needs in order not just to survive, but thrive. We want to be in a thrive state, everybody. And this program, we will share nutritional options that are available to fill those gaps that the food is not providing. Now, this is beyond supplementation and what Dr. Wallach calls the essential factors that the body needs. And we include those synergistic cofactors that allow the body to have optimal absorption so it can utilize what we're putting in our body even better. The statements that are presented on this program have not been evaluated by the Food and Drug, and the products discussed, again, are not meant to treat, diagnose, cure, or prevent any disease. This information is for informational purposes only. If you are pregnant, nursing, or taking medications, please consult your healthcare professional before starting any supplementation program. But the good part, because we bring good news, this genetic theory, I had several different things that were quote unquote genetic, has been proven to be incorrect through the science of epigenetics. Epigenetics is the study of how our own behaviors and environment can cause and change the effect and the way that our genes work. And with epigenetics, I love this word, everybody, we are empowered individuals and have more control than we think over our health journey. So we invite you to feel the difference and try the options that are shared on this program. Not just try it, give us 90 days. 90 days. We know for sure you will feel the difference and won't want to go back. So any testimonies that are shared on this program are voluntary. We do not pay anybody, and everything is coming from the heart, and we trust that everything is factual, because there's no reason for them not to be when you get on the right program. And to guide us in finding that right program, we are honored to have one of the founding fathers of that science, epigenetics, here to share the best options to obtain or maintain optimal health, Dr. Joel Wallach. Dr. Wallach, welcome to Ask Doc Live.
Well, thank you so much for the kind introduction and complete introduction, Rebecca and team. Great as usual. And, it's a never-ending story. There's always new people coming along. There's always new revelations coming on. And so, as I say, it's a never-ending story. If people think, oh, yeah, I've read that book, I know everything, I'm going to go about my life, you're missing it badly, okay? You can't know everything by just reading one book and that sort of stuff. And today, I'd like to talk about something that most people don't think about, is arthritis in juveniles, like kids under the age of 16. And most people think of arthritis as a degenerative disease of aging and old people. And, you got to expect that. He's 80 years old, he's going to have arthritis and so forth. You got to expect a little bit of that. Well, babies can be born with arthritis, okay? And it has nothing to do with aging. There's many different types and causes of arthritis. And today we want to talk about the juvenile arthritis in kids underneath the age of 16. Did you want to say anything before I get going here, Rebecca?
Well, so one thing that, whenever I heard what you were talking about today, really interested me, because I was one of these kids. My cousin was one of these kids that were suffering from what you're going to be talking about. And I know that we were not the only ones. And that was 40 years ago. I can imagine how much more the increase in this condition is, Dr. Wallach. So thank you so much for the research that you did and bringing this information to us.
Okay. Well, for that introduction, here we go. Just to give you some concept of what's going on here locally and in the world. Right now, as of this morning, it's been reported that there's 3 million kids under the age of 16 in the world that have diagnosed arthritis. In the United States alone, we have 300,000 kids under the age of 16 diagnosed with arthritis. And of course, doctors spend all their time putting the arthritis into half a dozen different categories, because that way insurance will pay for them. If there are a specific diagnosis, they'll pay a certain amount of money for each of the 6 different arthritides that are reported in kids under the age of 16. And I find that very frustrating, because they're thinking about paying for the treatment. They're not talking about preventing the disease or curing the disease. because they think that this is destined and there's nothing to be done about it. So we have 300,000 kids in America who are suffering unnecessarily with a half a dozen different variations on the disease arthritis. Arthritis is inflammation of a joint, is the shortest definition of it. And in kids, there's two, well, I say there's a half a dozen, there's two major divisions of arthritis in kids under the age of 16. Number one is just simple degenerative arthritis. And with all the usual things going on in the joints and so forth. And it's a progressive thing, of course, gets worse and worse and worse because the only thing that doctors do is treat the symptoms. We'll get into that in a minute. And then there's a arthritis in kids under the age of 16 where they have other issues that go along with it, like psoriatic arthritis. Psoriasis is a very simple nutritional deficiency of the skin. And so when you have psoriatic arthritis, you've got that deficiency that causes the dry, itching stuff going on in the skin, but you also have the things that are missing, which result in the arthritis part. And doctors, they just want to treat the disease. They don't want to prevent it, and they don't want to cure it. And you say, well, that doesn't sound right. Well, it isn't right, but that's the nature of the beast. They don't want to prevent it, and they don't want to cure it. They just want to treat it. Each year in America, we spend, now, so I hope everybody's sitting down, we spend $626.8 billion a year just to treat the symptoms of arthritis in the United States. And we're not talking about curing it or preventing it. We're just talking about treating the symptoms. $626.8 billion a year just to treat the symptoms of arthritis. That's per year. Okay. And then osteoporosis is a part of it, but they never mention that. Osteoporosis, of course, is when you have demineralization or lack of minerals and nutrition to the bones themselves, in addition to the joints. And you're talking about the leg bones, the arm bones, the ankle bones, the wrist bones, the finger bones, the toe bones, the neck bones, the back bones. So all these various bones are involved. When one's involved at the other end of the body, the other ones are involved. Okay. And now I hope everybody's sitting down on this one, because just to treat the symptoms of osteoporosis, now we're not talking about prevention or cure. We're just talking about to treat and prevent the symptoms of osteoporosis. We spend each year, along with Canada and Europe, those three areas, USA, Canada, and Europe, we spend $6,500 billion a year just to treat the symptoms of osteoporosis. $6,500 billion a year just to treat the symptoms of osteoporosis, which goes along parallel with the arthritis. And then there's a second major division of arthritis in kids under the age of 16. And these have an infectious thing that goes along with it. We're talking about rheumatoid arthritis. And of course, doctors say, oh, this is an autoimmune disease. The body's attacking itself. It's absolutely 100% nonsense. It is not true. When you have rheumatoid arthritis, whether you're 16 years old, 12 years old, 4 years old, or 84 years old, is caused by degenerative arthritis and osteoporosis. We're missing all these minerals, but also with a secondary infection with a bug called mycoplasma, and it gives a RA factor. And they say, okay, your body's attacking itself. So all we can do is treat the symptoms, but you'll have this forever. That's not true. Okay. There is an antibiotic called minocycline, like the bait fish, minocycline. Take a 6 weeks course of minocycline, the infectious part of the rheumatoid arthritis goes away. And then you still have to take the 90 essential nutrients to get rid of the degenerative nutritional deficiency part of the disease. Okay. And this is something that is absolutely avoided and missed by the pediatric orthopedic doctors. Okay. Because they're just treating symptoms. They're just treating symptoms. That's where all those costs come from. They're just treating the pain and the inflammation, the burning and the itching, and all the things that go along with it on the side. Like, you know, when you have psoriatic arthritis, and when you have rheumatoid arthritis, it's one of those things where doctors go home and say, okay, honey, we can get a bigger house now. I just got 3 new patients today under age 16. And they'll be with us for, say, 20-something years. And, you know, we'll be able to just treat them, and we'll have enough money to make a nice big mortgage payment. And that's how doctors think. Okay, you just say, that can't be right. That can't be right. Okay, well, most people take better care of their cars and they take better care of themselves. They'll check the oil in their car every time they stop for gasoline. They'll check the air pressure in their tires when they stop for gasoline. They put high test gasoline in their car. They check the amount of radiator antifreeze, even in hot countries, because antifreeze also helps with overheating of the water in your radiator in your car. And so again, people don't say, well, I'll just throw some dirt from Texas or dirt from Saudi Arabia in the car. It's only 10 cents a quart for dirt from Texas or dirt from Saudi Arabia. And that'll take care of the, instead of putting oil in there, it's $3 a quart. No. Okay. No, that's incorrect. And so most people take better care of their cars than they take care of themselves. And it makes me scream and pull my hair out. Okay. When I see the failure of the medical system and families when it comes to kids and arthritis under the age of 16. This is totally unacceptable. It's totally preventable. And here's where it starts. It starts when the mothers are young and they're not taught to take 90 essential nutrients when they're teenagers. And girls have 4 times the rate of osteoporosis as men, because when they hit puberty, 10, 12, 14 years old, whenever they hit puberty, what'll happen here is, now I'm a girl now, and I want to look nice and be thin and all that kind of stuff. And so I'm not going to eat any of these things. And I'm not going to take the supplements like the athletes do. I'm just going to live on vegetables. And so they have all these deficiencies. Okay. And so that's why they have 4 times the rate of osteoporosis as boys. Now, boys eat everything. If you slow down, they'll eat your leg. Okay. It's one of those things where, if it'll go in their mouth, they'll eat it. The boys are just like growing muscles and doing all these physical things and working on the lawns and the roofs and raking leaves and all that kind of stuff and playing sports. And so they're going to eat everything they can. And so they do get a lot more nutrition than girls get, because girls are restricting things because they want to be skinny and they want to have beautiful skin and all this kind of stuff. And so they think that avoiding these things are the best way to go. And that's why they have so many problems. Well, again, this is very simple. So what happens is when these mothers get pregnant, even if they're going to breastfeed the babies, they need to be, for at least a year before they get pregnant, they need to be taking the 90 essential nutrients. And then certainly all through the pregnancy. And if they're breastfeeding that baby, they still need to take the 90 essential nutrients. So the breast milk will be rich with the 16 minerals and 16 vitamins and 12 amino acids and 3 fatty acids. If they're not taking the 90 essential nutrients, if they're not taking these things, okay, we're in trouble. Now, let's say they are. Let's say they're taking everything correctly. But if they're eating gluten, if they're eating wheat, barley, rye, and oats, they want to have oatmeal for breakfast every morning like grandma had. They want to have things like whole grains 3 or 4 times a day. They want to have wheat, barley, rye, and oats in their waffles and pancakes and pizza crust. They want to have very, very high quality beer that's made from wheat, barley, and rye and oats. And there's beer made from rice. I like wine because it's made from berries and also made from grapes, of course. And so there's no wheat, barley, rye, or oats in wine. Now, it's one of those things where, again, if you're breastfeeding, ladies, you need to make sure you're getting all of the 90 essential nutrients necessary. And you got to stay away from all the bad stuff so you can maximize absorption so these nutrients will get into the milk. And even though you're breastfeeding and you're staying away from the bad stuff and you're taking your nutrients, I would still give your babies when they're born, in addition to your breast milk or Enfamil and Similac, I want you to also give them, use the dosage chart on the back of the label of our Kids Toddy, our Cherry Mints, let's see here, our Beyond Osteo FX, and also our EFAs, okay? And so the EFAs, you want to make sure they get that. Don't forget their collagen peptides, and you will build the bones and the joints and the cartilage and ligaments and tendons in these kids as they're growing up. And we can get rid of these disastrous joint and bone problems, whether it's osteoporosis or arthritis in kids under age 16. That is absolutely awful 3 million kids in the world, 300,000 kids in America alone. That is absolutely unacceptable. And so with that, I'm going to turn it back over to you, Rebecca.
Oh, Dr. Well, I just, again, I want to thank you for bringing this up. And parents, if you have kids that are wanting to do sports, but then they stop because they have pains in their ankles, it's not just growing pains. That was my thing. I started having pains in my ankles first, and then I started having pains in my knees. And then they were even talking about doing surgery on my knees because I had growths, arthritic growth.
And how old were you? How old were you?
At that time I was 15.
Wow. So you were under that age 16 group.
Yeah. So, it's not something to overlook, parents, grandparents. And for those of you who have not started having children again, you can start taking the supplementation now and give your babies that firm foundation, that start that helps to prevent. We can't, John, can I say that? Doc can say it. So Doc, you say it. What happens whenever we give the body what it needs before and during pregnancy? How does that benefit the babies?
Okay, well, there are no genetically transmitted birth defects. So that's where we're going to start. All birth defects are caused by nutritional deficiencies of the developing embryo. And so if you're going to provide the 90 essential nutrients for at least a year prior to conception and all through that pregnancy, and staying away from the bad foods so you can absorb all these nutrients and get them into the embryo, we can eliminate all birth defects. There are no genetically transmitted birth defects. It was all a big lie because doctors never wanted to say, oh, we don't know. It's just like when kids started dying of SID, sudden death syndrome, under a year of age, they were found dead in the morning. And doctors for 25 years said that these kids that died of SID, sudden death syndrome, were dying because the mothers were laying on them and suffocating them. For 25 years, that's what doctors said. And so many hundreds and hundreds of women whose babies died of SIDS committed suicide because their churches disowned them, their families disowned them, their neighbors disowned them because they laid on their babies and suffocated them. It was all nonsense. It was not true. Those babies were dying of hypertrophic cardiomyopathy heart disease, the same thing that are 500 to 1,000 young athletes every year in America die from, in their teens and 20s and so forth. It's a deficiency of a single nutrient, and it causes a sudden heart attack called hypertrophic cardiomyopathy heart disease. And this is something that we got rid of in animals, okay? Actually, we first learned about the cause of aneurysms and hypertrophic cardiomyopathy heart disease in turkeys, of all things. And we started putting these nutrients in the food for turkeys, and we ended that. And so that's why I started putting that, into the baby formulas. And we protested, we petitioned, we sued a dozen times, and we won. And we finally forced the FDA to force the producers of the Enfamil, Similac, and all the baby formulas, other baby formulas, put these nutrients in there. And within 6 months after that happened, everything changed. Suddenly now we didn't have cystic fibrosis anymore. Suddenly now we didn't have muscular dystrophy anymore. Suddenly now we didn't have sudden death syndrome anymore. Back in the 1990s, sudden death syndrome occurred at the rate of 135 to 140 per 100,000 normal births. Today it's 15 to 20 per 100,000 normal births. We've reduced it by 95% just by putting these nutrients into the formula, baby formulas, and into the nutrients that lactating mothers are getting. But the mothers still have to give up the gluten so they can absorb it. And that's where these last few are getting cheated, and that's why there's still a handful every year in America dying of sudden death syndrome, when really that should not happen. But it's happening because the mothers aren't taking their nutrients. Even if they are, if they're eating oatmeal for breakfast every morning, they can't absorb the nutrients and can't get it to the baby through the breast milk. So this is something we're very, very proud of. We've done our job here. And it's a matter of continuing to educate every year, because there's a new group of kids coming along, turning to be adults and getting into that age where they're going to start making babies. And so we need to educate every wave of new young parents coming along. And so here's where moms and grandmoms and dads and granddaddies and aunties and uncles can help out. When you give them a present, give them the 90 cents of nutrients, give them the Rebound, our sports drink, okay, with 100 nutrients in it. Our new sports drink, Rebound, has a lot of carbonation in it. And I open it up and put it in the refrigerator overnight. And so, it has 6 or 8 hours off gassing the carbon dioxide. So then during the day, I will sip on it and it's just flat. That's good. That's what I want. I want it flat. I don't want it carbonated. Okay. And so this has 100 nutrients in it. And so that's going to help you. Okay. And help the kids. It's better than all these soft drinks and things like Red Bull and stuff like that, which is just really sugar and caffeine. And so we really have to make sure that everybody knows all these things before they're conceived, all through their development as an embryo, and from the time they're born, whether they're getting a commercial milk replacer or breast milk or however they're going to do it. Okay, I know it's a long, twisted way, but I think that answers your question.
Yes, it does. Thank you very much. And with the Rebound and opening it up and letting it off gas so that there's no carbonation, it still tastes great.
Oh, it tastes wonderful.
And well, and I just wanted to say, for those of you who are impatient, don't want to wait, we have it in a powder form. You just add it to water, shake it up, and down it goes with no carbonation. And that's the way that I usually do it, is with either our canister or individual packets of the Rebound that are so easy to slip into the purse and be able to just go, wherever you're at, on something more than just water, feeling like you need a little extra boost. That Rebound in those individual packets is just absolutely fabulous. So, but here, Dr. Wallach, I wanted to bring something up. So juvenile arthritis, they actually have an acronym, JIA, juvenile idiopathic arthritis. Well, we just debunked that idiopathic. Okay. Idiopathic means they don't know the cause.
That's right. That's the doctor's favorite. Yeah, that's the doctor's favorite thing. It's one of those things it's got to be, well, they're pushing the autoimmune thing for this arthritis in kids at the age of 16. It's an autoimmune thing. Their body's attacking itself. And that's all they beat the drum on: autoimmune, and idiopathic and autoimmune, because that way they don't have to be responsible for preventing it and getting rid of it.
That's right. I guess if you claim that you don't know what's causing it, then you can't, or you don't have to look for a cure, right?
That's their trail.
So that's, folks, like I said, pay attention when those kiddos start complaining about different aches and pains. They don't have to go through it. I'm so thankful that I found this before my youngest one started getting those aches and pains. And he's going to be taller than all of them, and my tallest one is 6'2". So I think it's absolutely fabulous, Dr. Wallach, what you have done, what you have put together, and the fact that we are able to bring you to the world live every Friday. And we're not the only program, but having this 2 hours one-on-one with you, where we can bring people in with their question and know that they are going to get a nutritional solid foundation of information, recommendations from products, Dr. Wallach, that have proven time and time again to be effective. It's the only solution I found that helped me. And I encourage everybody to take it. You're worth it. You are absolutely worth investing the time that you're spending today. And also, yes, and educate yourself. So Dr. Wallach is holding up his book, Epigenetics, The Death of the Genetic Theory of Disease Transmission.
And there's a CD that goes along with it by the same title.
Yes, I have that right here. See, I have one that looks just like it now.
There you go.
I love it. I love to be able to use these as resources for myself, my family, in my health coaching business. And again, you can go to drjwallach.com and find all of Dr. Wallach's books. The most popular ones are on our website, askdoclive.com. So let's get to some questions, Dr. Wallach.
Okay.
And I know we have on with us Mr. Erickson. So I don't know if he will come on. I have his question here because I know you're going to have questions for him. So Mr. Erickson, if you would unmute yourself and come on live, that would be fabulous.
Yes, I'm here.
Wonderful. You are on live with Dr. Wallach. Go ahead and ask your question, please.
Well, yes, I have a question about I suffer from a brain exhaustion after a stroke. And it's kind of problematic since well, the doctor defined it as they call it minor stroke because all the physical symptoms has disappeared, and what's left is all the tiredness and the exhaustion that usually comes with or after stroke or things like that.
Okay. Okay. Well, how old are you?
Well, I'm 56.
Okay. And how much do you weigh?
I weigh 78 kilogram.
Okay. So about 160 pounds. Okay. And how tall are you?
I am 184 centimeter.
How many feet is that? How tall are you in feet and inches?
Well,
I'll get that conversion for you, Dr. Wallach.
Okay. So where are you from?
I'm from Sweden.
Yivis and Yump and Yemeni from Sweden. Okay. All right. Very good. The brain requires 90 essential nutrients. Okay. And you can be taking them, but if you're eating wheat, brown, rye, and oats, you're eating bread and waffles and pancakes and drinking beer made from wheat and all that kind of stuff, then you cannot absorb these things. Okay. And you're having trouble. So here's what I want you to do. Give up all the bad foods. No fried foods. That means no air frying, no deep frying, no pan frying. Absolutely no processed meats, no bologna, salami, pastrami, pepperoni, ham, bacon, all that kind of stuff's got to go because of the chemicals in them. Then no oils, no olive oil, no coconut oil, absolutely no salad dressings, no cooking oils. And then you need to get rid of the gluten, no wheat, no barley, rye, and oats. There are no such things as gluten-free oats. The gluten in oats is called gliadin, so no wheat, barley, rye, and oats. You need to live like an Asian, live on rice and sweet potatoes and beans and squash. You can have red meat, but it has to be roasted medium rare. Okay, you cannot have them deep fried and burnt and all that kind of stuff. And then no sugar of any kind, and then absolutely no carbonated drinks. Even the diet ones got to go because the diet drinks still have carbonation in them and neutralized stomach acid, so you cannot absorb minerals and digest food. Then at 150 pounds, 160 pounds, I want you to, let's see here, I want you to take 2 healthy brain and heart packs a month. 2 healthy brain and heart packs a month, the full dose of everything twice a day. I want you to get 2 bottles a month of our MSM. So you can take 3 at breakfast, 3 at lunch, 3 at dinner time. They're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makes the bone itself, including the skull. Okay, because you could have osteoporosis of the skull. Do you have any ringing in your ears or tinnitus or dizziness or anything like that?
Well, take that again.
Do you have any
ringing in your ears?
Do you have any noise in your ears, any ringing or buzzing in your ears?
No, I don't have anything like that.
Okay, good. All right. Then I also want you to have 1 scoop of our collagen peptides for breakfast in the morning, your morning drink. I want you to have 1 scoop of the collagen peptides, your evening drink. And then I want you also to have, let's see here, I want you to take our Synaptive. Take 3 of those Synaptive twice a day. That's 2 bottles a month. The Synaptive contains the raw materials necessary for the brain cells to talk to each other. Okay. And so I take 3 of those twice a day myself, and I only weigh 142 pounds. Okay. I'm considerably lighter than you are. And then I also want you to have Memory FX. Take our Memory FX. Take 3 of those twice a day. I want you to eat 3 eggs twice a day. 3 eggs at breakfast, 3 eggs at dinner time. I'm assuming you're not on statin drugs. You do not want to be on statin drugs to lower cholesterol. I want you to have 3 eggs at breakfast, 3 eggs at dinner time. They have to have soft yolks. Hard-boiled eggs won't count. Fried eggs won't count. They're going to be soft poached, soft with soft yolks. Soft boiled with soft yolks. Soft scrambled in butter. That's how I take mine. 3 at breakfast, 3 at dinner time. And then let's see here. I think that's going to cover where we want to start. Oh, for the energy, we do have, again, the Rebound. Okay. You can take our Rebound either in the cans. Don't forget to pop it open 4, 5, 6 hours before you're going to drink it. Let that carbonation off gas. We do have, as Rebecca pointed out, we have the sticks. There's 36 in a box of the Rebound. They don't have any carbonation in them. And then we also have the canister, and you put, I think there's 36 servings in the canister of the Rebound. And I drink 1 or 2 of those a day and getting my energy. I'm 83 years old. Most people think I'm in my 50s when they look at me and look at my energy and look at how I look, because I don't look like I'm 83 years old. I don't think so. Okay. Okay. So give us a call every couple of weeks. You can start the diet immediately when you hang up. Give all the bad foods to your doctor. Okay. Give all the bad foods to the doctor. Give the doctor all the wheat, bran, rye, and oats. Say, here, doctor, I love you, and I don't want to throw this stuff away, so I'm giving it to you. So it's not just wasted. Please consume it all yourself. Okay. And then you want to be taking the essential nutrients as we've outlined for you. And then contact us every week or 10 days or 2 weeks, and we'll walk you through this. And, you know, we're toll free. So your story will help a lot of people. We look forward to hearing from you. What's your first name?
My first name is Ingemar.
Oh, Ingemar. Okay. Ingemar Erickson. Ingemar. Okay. Thank you, sir.
All right. Thank you, Ingemar. And everybody, the replay of this program is provided at AskDocLive.com. So go there. You will find the replays from, I think there might be one missing. For the last 2 years, we have been going solid with Ask Doc Live, and the replays are all posted there. So as you're going through and listening and you think, oh, well, I have those symptoms, and you're not able to write down exactly what Dr. Wallach is recommending, go back to those replays. You can play that replay over again. If you are listening and you hear something that somebody that you love or care about is dealing with, you can share that video with them as well and make sure that they're getting information. Even if it's just planting a seed, you're planting that seed of hope that there are other alternatives. So thank you so much, Ingemar, for coming on with us today. And thank you, Stacy, for sending him to the program so that he can get information from Dr. Wallach as well. Let's go to the next hand that is up, Dr. Wallach.
Okay.
And next we have Michelle. Michelle, go ahead and unmute yourself. And if you're able to come on camera live with us, that would be fantastic.
Hi. Good
Hi,
morning.
Michelle, welcome.
I'm coming all the way from Belize.
Okay. Welcome.
And
how can we help you?
My situation is that 3 years ago, 3.5 years ago, I had colon cancer. I did a surgery, remove a tumor from the large colon. And then on January of this year, I was doing all natural therapy, and it was going very well. But this year, January 24th, I was rushed into surgery because my small bowel twisted on me. I was in severe pain for 48 hours. I came out of the surgery, and
you have to stop there a minute. I didn't get why were you rushed into surgery? I didn't get what it is your problem was.
My small intestine twisted.
Oh,
According to the
okay.
doctor, the small intestine twisted.
Okay. Okay.
And so they untwisted it. And I came out of surgery, I came home, nobody told me how to eat, what I should do. And I had in one of the Penrose, I had a perfume of leaking. I was leaking profusely. And I spent 11 days in the hospital, couldn't eat at all. And I was draining a lot of bile. It was green, it was in my poop, it was in my vomit, it was all over the place. And eventually I began eating, and everything I eat, I would vomit. I would cannot hold it down. And after that, I was just constantly in pain. Right now, I'm living on painkillers, gas. I have a gastritis.
Okay.
I
Okay,
live on
stop.
painkillers.
Okay,
Yes.
stop there. How old are you, Michelle?
I'm 43.
Okay, and how much do you weigh?
Right now, I'm at 148. I dropped
148.
from 180. I was at 180. I dropped to 148 because I keep
Okay,
losing
how
weight.
tall? Okay, how tall are you?
5'8".
5'8". Okay. Well, here's what I want you to do. I want you to make sure that yourself and everybody in the house, including the dog and the cat and the raccoon and rabbit and whatever you got in the house, okay, the parrot and so on, everybody's got to be drop dead gluten-free. No wheat, no barley, rye, and oats in the house. You need to live like an Asian, live on rice and sweet potatoes and beans and squash and vegetables. No wheat, barley, rye, or oats. No wheat, barley, rye, and oats. And when you clear all that out of the house, no wheat, barley, rye, or oats. Don't have one cheat day a week. Don't do that. Do you have any ringing in your ears or noise in your ears?
Not really, but sometimes when I look down, I have dizziness. I don't have the
Okay.
ringing in my
Okay.
ears.
So you do have some vertigo or dizziness. Okay. Okay. And then let's see here. Do you have anything going on like, has your voice changed any? Or do you have trouble swallowing?
I suffer bowel obstruction. I don't have problems swallowing, but I suffer bowel obstruction.
Okay, from bowel obstruction, not high up, but bowel obstruction. Okay. Yeah. Okay. So this is, did they take your appendix out when they did the?
No, I still have my appendix.
You still have your appendix.
They did
Okay.
not.
Okay. Did they take your gallbladder out?
I still have my gallbladder.
Okay, good. All right. Well, again, here we go. Let's see here. Again, at 148 pounds, I want you to take or get rid of all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, barley, rye, and oats, no sugar, no carbonated drinks. And then at 148 pounds, I want you to take 2 healthy brain and heart packs a month, a full dose of everything twice a day. I want you to get with 1 bottle a month of the MSM, so you can take 3 at breakfast, 3 at dinner time, or 2, 2, and 2 for a total of 6 a day. And they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, including the walls of your small intestine, including the ligaments holding the small intestine together and all that kind of stuff. Also the walls of arteries and veins, also your skin, your lungs, your stomach, all that kind of stuff. And then I also want you to have 1 scoop of our collagen peptides at breakfast drink, and 1 scoop of collagen peptides at our dinner drink. And then I also want you to have our ultimate enzymes. Get our bottles of ultimate enzymes. We call it the gallbladder bottle. I want you to take 1 or 2 of those, say 5 to 10 minutes before each meal, with a couple ounces of water. And that's going to help you with digesting and absorbing nutrients in food. That's going to help you, especially when you have a history of, having all that green bile going everywhere and all that kind of stuff. That tells you your liver was impacted one way or another. And so we're going to give you the gallbladder in a bottle, okay? That's called Ultimate Enzymes. Take 2 of those, say 5 to 10 minutes before each meal with a couple ounces of water. They're big bottles, so 1 bottle a month will do. And so let's start there. And Of course, for energy and all that kind of stuff, you can use a Rebound. Again, if you're going to use the cans, you got to pop the top and then put it in the refrigerator and then drink it the next day. But if you take the sticks, individual servings, and the sticks are the canister with a scoop in there, it's okay because there's no carbonation. You can just drink that right away. Okay, that'll give you a lot of energy, and that's going to help you in that category. But with those 90 essential nutrients, that's going to rebuild everything, including the walls of your intestine, the walls of your arteries and veins, your stomach. Everybody's got to go to work and you know, earn their keep, including your intestines. Okay.
Okay. Okay.
Okay, Michelle.
All right, thank you, Michelle. And get back with Hilda. She'll be able to help you get the products that you need and get them to Belize. So there are many countries that we ship direct to from Longevity. And for those countries that we do not ship directly to, we do use US shippers. So I love the fact, Dr. Wallach, that there are so many different ways to get the products that we can eliminate almost every excuse, almost, in helping people get what they need in order to have thriving lives.
Yeah, right now we're shipping to 80 different countries, so we're bound to be able to be shipping to Belize.
Yes, yes, yes. And if you are on with us and you are in another country where we do not ship directly to, and you are interested in getting products directly to you, please make sure that you reach out to the person that invited you to this program, and we can get with the company and find out exactly what needs to be done in order to make that happen. So I love Longevity, Dr. Wallach. You started Longevity so many decades ago. I'm not going to say years because we're in
50.
decades.
Yeah, 50 years ago.
And you've put together a company of innovation. You know, your son Steve Wallach is now leading the company along with his wife Michelle, and just the way that they are putting products together that are creating solutions and meeting people where they're at.
Yeah, well, I'm very proud of them. They're very innovative and hardworking. They work about 50 hours a day.
I believe it. I believe it. Well, Dr. Wallach, I have another question coming in, and this is also from Hilda in regards to her friend Yvette, who is 53 years old, 165 pounds, 5'4". Yvette is dealing with fibroids, swollen ankle. The doctor says heel spurs and plantar fasciitis. She has tiredness, and there's lines on her fingernails.
Okay.
It doesn't say anything about blood sugar or blood pressure issues.
Okay, well, the odds are if they're telling about fingernails, if there's something going on with blood pressure and sugar, they would tell you. Okay. So, at any rate, at 163, 165 pounds.
165 pounds, yep.
Yep, in that area. Okay. And so Yvette's got to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no gluten, no wheat bioranos, no sugar, no carbonated drinks. And then she also needs to have 2 healthy brain and heart packs a month, 2 healthy brain and heart packs a month, a full dose of everything twice a day. She's got a lot going on with her connective tissue and ligaments and tendons and bones and stuff like that. And so I want her to have 2 bottles a month of our MSM, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time. And they're designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone mix, bone itself, and bone spurs and ankle swelling and all that kind of stuff. And then I also want her to have, let's see here, for the fibroids, I want her to get our Xera, Xera-Fem, Xera-Fem. Take 3 of those twice a day. That'll be 2 bottles a month. And they're designed to give the ovaries and the other parts of the girly system, okay, what they need to be able to make estrogen and progesterone and all this stuff like that. Okay, now the fibroids will be also taken care of in addition to the Xerafem, but also the MSM, the collagen peptides will also help with the fibrous connective tissue that's built up in her female organs. Okay, they'll help take care of that. And if she has pain where she has all this swelling, okay, where she has bone spurs and ankle stuff, if she has pain there, she use our CM cream. Say for every teaspoon of CM cream she puts on there, she could use, say, 5 or 10 drops of the trauma oil from our aromatherapy oil division. Okay, and it'll give her a couple hours of pain relief. But usually, if she does what we say here, she won't need the pain relief longer than just say 10 days to 2 weeks or so forth. And by then, the pain will be significantly reduced or eliminated. Okay, we do this a lot. Okay, and so we have a lot of ladies going through menopause and all that kind of stuff, or even premenopause, and they're still in the early in life when she can still be fertile and all that kind of stuff, and they get fibroids and so on, because they're not getting the nutrition they need, because they're not taking the essential factors on a regular basis. But additionally, if they were taking the essential factors and they're eating gluten, having waffles and pancakes and oatmeal for breakfast every morning, you cannot absorb the nutrition even if you're taking it. People say, well, I take all that stuff. Well, if you have all the symptoms of the deficiency, you're taking it, that means you're not absorbing it. What do you eat for breakfast every morning? Well, I've been eating oatmeal all my life for breakfast. Well, that's why. Because there's gluten in oatmeal, and that will destroy the lining of your small intestines. You'll lose 98% of the absorptive surface of your intestines. It goes from looking like a shag rug to looking like a plastic tube. Not good.
No,
but
it's not.
But this is all reversible very quickly if you do everything right.
And Dr. Wallach, plantar fasciitis is one thing that I dealt with. That is so painful.
Mm-hmm.
So painful. And since starting on your program, I haven't had not even a hint of problems from it.
Yeah, and of course, it's just a simple nutritional deficiency. Could be in the back, it could be in the bottom of the feet, it could be both places, and so forth. And so this is not an unusual thing. These are very common issues. And of course, the orthopedic doctors like them because they can get great results with pain relievers in a couple of days or a week or so. And the people, I was in such pain for years. My doctor gave me this pain relief, and 2-3 days the pain was gone for the first time in years. I'm going to leave everything in my will to my doctor. Well, actually, the doctor didn't really do that good a thing because he didn't stop the progression of the disease. He's just relieving the pain, just relieving some of the symptoms. He's not eliminating the cause. And this is very typical of the medical approach of these chronic diseases that they like to treat and reduce the symptoms, so it makes the patient happy and keep coming back. Don't forget, we spend $626.8 billion a year just to pay doctors each year in America. That's just in America, to pay for treating symptoms of arthritis. For osteoporosis in the United States, Canada, and Europe, we spend just to pay for the symptoms each year with those 3 regions, $6,500 billion. Okay, not to prevent, not to cure, but just to treat the symptoms. I don't know. Doesn't sound legal to me.
No, it shouldn't be legal, Dr. Wallach. But we're looking for solutions, not bandages to cover up the symptoms. At least not me. I didn't know that there was an option otherwise, but I kept feeling that there was something. There's got to be something. What am I missing?
And now you're helping millions of people get the information. We can't thank you and your team enough.
Well, I can't stop. I can't stop. That's just the way it is. And you had mentioned earlier in the monologue where, people were thinking that they were doing right and eating all of these whole grains and oatmeal. And I work with so many people that go, well, I do organic. Organic does not make it any
It's just
less damaging.
It says, well, that bullet can't kill me. It's copper jacketed.
Okay, I'm not going to expound on that one, but there's still the gluten. It's the gluten within that is destroying the inside of your intestines, that's creating the inability to absorb the nutrients, that's causing those quote unquote autoimmune conditions that the body's attacking itself. Well, yeah, the
No
body's trying
way.
to survive and it's not getting what it needs. So anyways, folks, no wheat, barley, rye, or oats, not even if it is organic. Organic
Yeah.
means they use less.
Don't even say
pesticides.
the word. Don't even say the word.
Yeah, no wheat, barley, rye, or oats. And for a long time I thought, oh, I'm not gluten intolerant. But when I did go gluten-free, it made a world of difference. And I've had several people fight me on that. And when they finally break down and do it, they're like, I was stupid not to listen. And I had somebody tell me that last week. I was stupid not to listen and think
Now,
that it
Rebecca,
was just a fad. It is not a
Rebecca,
fad.
does the wheat in beer still have gluten in it?
Yes.
Does the wheat in whiskey still have gluten in it?
Yes. And rye. So I don't care if you're doing wheat whiskey, rye whiskey, they still have gluten. I
Yeah,
mean,
there's beer made from rice from Australia, New Zealand, and Asia, all these Asian countries, Japan and China and so forth. You can even get rice beer in Hawaii.
one thing that because I'm not a big drinker myself, but I wanted to look at labels. I started really looking at labels and including the labels on the alcohol bottles. When you have something that says grain spirits, put it back on the shelf. You don't want that, because those grain spirits, even though it's supposed to be something like vodka, originally was made just from potatoes. Well, now you go and you look at the different varieties of vodka and you have grain spirits. And that totally takes away from.
Well, that's how they increase the alcohol content by adding the grain spirits. That's why they do that, to increase the alcohol content.
Yeah. So for those that like to enjoy a drink here or there, or, only in celebrations, whenever, you really want to pay attention to what you're drinking, because gluten is not just in solid foods.
Yeah, and wine
everywhere.
is made from berries and grapes. So wine tends to be the safest of the alcoholic drinks.
And I personally like to go sulfate free and nitrate free. So, well, Dr. Wallach, we are 2 minutes to the top of the hour. So let's go ahead and take a quick break. And then we're going to come back with another question from Teresa and one from Raj. And if you are on live with us and you have a question that you would like to ask, in the Zoom menu, there is the option to raise your hand. So you might have to click on reactions. Reactions will give you that option to raise hand, but that is how you raise your hand when you're on live with Ask Doc Live on Zoom. So everybody, we will be right back. Again, go to AskDocLive.com, find all of our replays, find Dr. Wallach's most popular books. And if you were not invited by somebody specific, you're going to find a store there also. But please, if you've spoken to anybody about Dr. Wallach, longevity products, anything that you're hearing today, get back with them. They cared enough to share this information with you. Tell them thank you and say, how can I get it for myself? Ask them. They'll have their way of getting the information or getting the products that you need, including the good foods, bad foods list. You really want to make sure that you get a hold of that list, print it out, put it on your refrigerator, save it to your smartphone, take it with you when you go shopping, and focus on that good food side of that list. For me, when I tell myself I can't have something, I want something more. When I focus on the good things that I can have, and I get on the supplementation and my body is no longer in a starvation mode, I don't have cravings for that other stuff that I'm not supposed to be eating anyways. It all works together. We will be right back on Ask Doc Live. Hello and welcome back, everybody, to Ask Doc Live. My name is Becca Dukes Kozak, and I am so honored to be your host of this 2-hour program with the one and only Dr. Joel Wallach. Now, for those of you who don't know, Dr. Wallach started out as a little boy with some pretty significant behavioral issues. Now, in recent years, there has been a rise in childhood issues with behavior, attention, being able to sit through the classroom, and being labeled as having something within a spectrum. Okay. Well, folks, it gives me hope, and I hope it gives you hope also, that those children need to be nurtured. They need, all children need the nutrition that we are talking about today, because you don't know what a great impact they are going to have in the lives of others. And the man that we have with us on this program every Friday has impacted millions. And this is a gentleman where when he was young, they wanted to institutionalize. And I just praise God that his parents did not go that route, because we are able to sit here with him. And my goodness, Dr. Wallach, how many books have you published? Let's get you unmuted. I know publications, there's...
Okay, 21
21.
best-selling books, 21 best-selling books.
21 books.
Yeah, bestsellers. And of course, I've got another one coming out here pretty soon. And then we have 100 CDs and 45 or so DVDs. And so it covers just about every spectrum of health and disease anybody might be interested in. And I like people to start, and one of the things that really started it all was one of my first dozen books was, there you go, Dead Doctors Don't Lie.
Don't lie.
It's the only time they won't. Okay, and then we have this, it's in English and Spanish, and then the CD by the same title, Dead Doctors Don't Lie, is in 9 languages. Okay, we've sold over 600 million copies of that. Okay, so we're very, very excited about the information getting out there because they were going to institutionalize me, as you said. My parents were packing my clothes and everything, and I had been to 20 doctors over a period of 5 years, and not one of them could help me, not any way, shape, or form they could help me. They were not able to help me. And so that's when they decided to institutionalize me before I killed somebody, because I was a very strong kid at 9 years old, and I was sitting on the end of the bed, and my mom and dad are packing my clothes because I'm supposed to go to this institution on Monday. And I'm saying, well, why is it I'm having all these problems? Nobody else is having these problems. Why me? And so I'm saying, well, you know, I'm eating the same thing that the animals are eating on the farm. So why is it they don't act like me? Then he said, no, wait a minute. We're giving them alfalfa pellets that are enriched with vitamins and minerals. And so the next morning before breakfast, I threw my Cheerios and my oatmeal out to the chickens, and I went to the barn and I got the alfalfa pellets we would give the calves, and I put them in my cereal bowl, put milk in it, and I had it for breakfast. That was Saturday morning. Sunday morning did the same thing. Monday morning did the same thing. By Monday afternoon, I was cured. After 5 years and 20 doctors getting worse and worse and worse, and they were going to institutionalize me for the rest of my life probably, which might not be long. Okay. Suddenly now I had cured myself, and I realized when I was 9 years old, the doctors had no earthly clue about how to prevent and reverse disease. I'm only 9 years old and I figured that out. And so it's one of those things where I figured I better spend my time dealing with this so they don't sneak up and put cuffs on me and take me to the institution. Okay. But it didn't take long. Within a couple of weeks at the church, everybody's whispering and pointing at me because I wasn't disrupting the services anymore. And then after a couple of months, people come up to me and said, well, I have diabetes. What do you think? I said, I'm just a kid. I don't even know what diabetes is. And so then I started better learn this stuff. And I started getting books and reading and so forth. And that's how all this happened when I was 9 years old.
Well, I'm so glad that you started reading, Dr. Wallach, and that you did beyond reading. You did research, and you put your research into books that we are able now to get our hands on and take in that information that is so empowering. So,
And I proved there's no birth defects that are caused by bad genes. I got rid of cystic fibrosis, found the first non-human case of cystic fibrosis in monkeys at the NASA facility in Yerkes Primate Center at Emory University in Atlanta, Georgia. And I told them it wasn't genetic. There's a whole thing I went through, proven by getting biopsies of the other baby monkeys there, and proved to them that it wasn't genetics. They fired me. Said, well, like everybody knows it's a genetic thing, so they fired me. And so that's when I went back to school and became a naturopathic doctor. And I'm licensed in Oregon and in California. And I've been seeing patients ever since then. 1977, okay, as when they fired me. In 1982, I graduated from naturopathic school, and I went there really just to teach because I had 4 kids. I was a widower. My wife died. They made a mistake and killed her, okay? And so it's one of those things where it's just been one bad piece after the other in the trail associated with doctors. So I went back to school and became a physician, naturopathic physician, and began to treat people. I'm seeing that nutrition solves the problems in most cases. And so, every once in a while you need an antibiotic to, get rid of an infection. But most cases, all these degenerative diseases and things going on in the brain and the heart and the liver and the kidneys and the bones and the lungs and digestive system, it's all nutrition. And it was very obvious. And so that has been the direction we've gone. And the most recent one, of course, it's all in your head. That particular book, do you have one of those?
I do.
Okay. There's 25 different diseases that we've reported that are caused by osteoporosis of the skull, squeezing the 12 pairs. I got it. 12 pairs of cranial nerves. And also, there you go.
What's on the other side?
Okay, 12 pairs of cranial nerves and also the spinal cord. And so we've been able to solve all those diseases. The doctors say, oh, they're autoimmune, the body's attacking itself. They're genetic, the body's attacking itself, all this kind of stuff. They're all just simple nutritional deficiency diseases. Anything like AFib, atrial fibrillation, is not something wrong with the heart. It's just skull squeezing the 10th cranial nerve causing the symptoms in the heart. And we can get rid of all that stuff just by getting rid of all the bad foods and taking the 90 essential nutrients with some extra stuff to make the brain happy, including eating eggs and so forth. And so you and I have a new CD coming out here pretty soon. It's at the printer now. We've approved it and everything. And so next week sometime we should have it in our hands and be able to start shipping it. It's the same title as the book. It's all in your head. And it has a year's worth of information in it that we have developed over the years in treating osteoporosis of the skull. And so all the stuff that goes along with that, including a sister disease called MS, multiple sclerosis, because they both overlap and they kind of run together, osteoporosis of the skull and MS. And so there's, one doctor might say it's MS, another doctor might say you got some kind of degenerative genetic disease, but they will never say osteoporosis of the skull. And so that's why Ms. Rebecca and myself, we came out with this beautiful CD, and I'm just very, very proud of that. It's going to be a big hit because it goes into our year of all the stuff we have done. Okay, when this book came out, it's all in your head. Now we have a year's worth of accumulated information on treating this. And it says sister disease, MS, multiple sclerosis. And we turned MS, multiple sclerosis around like overnight. And doctors say, oh, it's an autoimmune disease. MS is an autoimmune disease. The body's attacking itself. And it's absolutely, positively not even close to true. Okay, it's a simple nutritional deficiency disease. And do you remember what that nutrient is that we're deficient in when you have MS?
I do, but I'm not going to tell you which one.
Yeah, get
Because
the book.
it's not just one.
Yeah, get the CD, get the book, get the CD, and so you change your diet. You take these 90 essential nutrients, a little sort of more emphasis on some of them, and MS goes away in weeks. I don't care if you've had it for 20 years; it'll go in weeks. And so we're so excited about this, and it's all in your head. You can get 25 different diseases from osteoporosis of the skull alone. We can get rid of every one of them. We can prevent them. I'm 83 years old. I don't have any of those diseases. Do you have any of those diseases right now, Rebecca? No.
Not
But
anymore.
you had some of them,
I had many.
but you're
Yeah.
able to get rid of them. Yeah, yeah.
Yeah. Yeah.
And
It's incredible. It's absolutely incredible. And I can't thank you enough.
well, see, you're thanking me enough by sharing your information with other people, because you're a middle-aged woman, but you look like you're 25.
I feel 25, Dr. Wallach. So look out, world. Here we come. Well, Dr. Wallach, Raj has a question. He has a friend that has been diagnosed with ALS, also known as Lou Gehrig's disease. Wants to know if there's any hope for him.
Well, ALS, amyotrophic lateral sclerosis, well, that gives you the clue right there. Lateral sclerosis is meaning scar tissue in the outside part of the brain. And so you're getting symptoms, motor symptoms by that is Lou Gehrig's disease. Well, again, we don't have a weight on this guy, so let's just go by 100 pounds. Per 100 pounds of body weight, needs one healthy brain and heart pack per month. Needs one bottle of the MSM, so I can take 3 twice a day per 100 pounds of body weight for the connective tissue and stuff like that. Needs collagen peptides, a scoop of that with a breakfast drink, scoop of that with the evening drink. Also needs the Synaptive to get 2 bottles a month, so it can take 3 twice a day per 100 pounds of body weight. That's the biochemistry necessary for the brain cells to talk to each other properly and gently and safely. Also needs 3 eggs twice a day with soft yolks, because Lou Gehrig's disease is very, very closely related to MS and Parkinson's disease. They're all kind of related, okay, and in certain, what should I say, manifestations of osteoporosis of the skull. So 3 eggs twice a day. Do not get on any statin drugs or lower cholesterol. That was really a major, major, major misfire by the medical system, okay, because Alzheimer's disease is a result of statin drugs. Alzheimer's disease came out in 1960. It didn't occur. There was dementias, but not specifically Alzheimer's disease until 1960. And that was caused by the drugs, the statin drugs that lowered cholesterol, because they mistakenly believed, falsely and incorrectly believed, criminally believed, that cholesterol caused plaque in the arteries, and blockage in the arteries. No, no, no. It's fried foods, processed meats, cooking oils, all that kind of stuff, salad dressings, those kinds of things, oxidized, turn into trans fats, heterocyclamines, and that's what causes blockage in the arteries. And of course, the Alzheimer's disease is a man-made disease. Okay, it's a doctor-created disease. We spend over $305 billion a year just treating the symptoms of Alzheimer's disease. They don't spend any money to prevent it. They don't spend any money to cure it. And they're saying by the end of next year, it'll be $1 trillion each year just in America alone, just to treat the symptoms. $1 trillion, and it's coming. It's marching at you, okay? And so really, 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 we got to do a better job of getting the information out to humanity. People in every country in the world have been really messed up by misinformation. And everybody said, well, my doctor says. Well, anytime you say your doctor says, you're in trouble, okay? And so you really need to say, okay, I want to see the research, print out something for me. And of course, even the research may be twisted. And so you have to look at all the views and check the one that has the best results. Over to you.
All right. Thank you, Dr. Wallach. Now, Jana has a question in regards, or on behalf of her husband, I should say. He's 70 years old, 183 pounds, 5'6", no blood pressure, no diabetes issues, no other health issues. He does have the beginning of cataracts. What can they do?
Okay, there's real cataracts and imagined cataracts. Okay, it could be osteoporosis of the skull, squeezing the optic nerve, the optic vein, and the optic artery. And the doctor doesn't know what's going on there. So he just says, well, you have cataracts. Come on in, we'll take your cataracts out and put some lenses in your eyes. And sometimes it helps and sometimes it doesn't. Okay. And so, but at any rate, when you have things like a diagnosis of cataracts, let's say for a moment that's correct. Cataracts can be caused by osteoporosis of the skull, squeezing the optic nerve, the optic vein, the optic artery. You can also get cataracts by eating fried foods, air fried, deep fried, pan fried, by using a lot of salad dressings and cooking oils and all that kind of stuff, because they oxidize and turn into trans fat cytosine, causing free radical damage. And it always seemed funny to me that why would free radicals just attack the lens in your eyes and no place else? And so there's got to be something else going on in there, okay? And it could be just osteoporosis of the skull squeezing the optic artery, the optic vein, and the optic nerve. So we approach it from all directions, and we have a very, very high rate of improvement. And sometimes it's improved so much that the patient will say, you know, let's not do any surgery right now. Let's see. And within 6 months' time, you go to a different doctor and they can't find cataracts anymore. Okay, because it really wasn't a cataract. It was really just osteoporosis of the skull squeezing the optic nerve, the optic artery, and the optic vein. So let's say it is a cataract. Get rid of all the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, brown rice, no sugar, no carbonated drinks. And then they need to take per 100 pounds of body weight, okay, and see, weighed what, 150, or, 180.
183 pounds.
183 pounds, yeah, okay. So needs 2 healthy brain and heart packs a month, full dosing twice a day. Needs 2 bottles a month of the MSM, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time. And then the collagen peptides, a scoop of that with the morning drink, scoop of that with the evening drink. Needs the anti-inflammatory stuff, okay? And there I would go with I'd go with something like herbal rainforest, okay, and get a hair analysis, see if there's any toxic metals like lead and mercury and uranium and stuff like that. Get a hair analysis and see if any toxic metals are contributing to this, what's going on. And don't forget, it could be some manifestation of MS. It could be a manifestation of osteoporosis of the skull. So don't forget the 3 eggs twice a day with soft yolks. Anything to do with the brain or the nerves or the spinal cord, 3 eggs twice a day with soft yolks. Hard-boiled eggs won't count. Fried eggs won't count. And in fact, fried eggs can cause cancer. And so you need to take soft-boiled, soft yolks, soft poached, soft yolks, soft scrambled butter. That's how I take mine. And so then give us a call and let us know what's going on.
And Janice says, thank you. He was already on the tangy tangerine and the OsteoFX. Now she knows what else to add. And a cute little note that she put her here. One of their very first dates with her and her husband was going to one of your seminars in Eugene, Oregon. I thought that was really cute.
Yeah, well, that's where I started out. You know, my first clinic was in Oregon, because that's where I was teaching at the naturopathic college there, nutrition, teaching nutrition there, and also taking classes so I could get my degree as a naturopathic doctor. And so I practiced there for 12 years. I'm still licensed. I graduated in 1982, and I'm still licensed in Oregon. I still go there. I haven't been there in almost 3 years now because of the COVID thing. I haven't been anywhere in 3 years since the COVID thing. So that's why we're doing so many Zooms and things now. So I can't wait until this COVID thing is absolutely over. And so, because right now I'm concerned about getting on an airplane because they're canceling like 3,000 flights a day and that kind of stuff. I don't want to be spending 2 weeks in an airport with having a bunch of ill-mannered people coughing COVID virus on me and all that kind of stuff. So I'm going to stay home until it's all cleaned up.
Sounds like a good plan, Dr. Wallach. We don't want to lose a national treasure, that's for sure.
Oh, thank you,
None
dear.
of us. None of us. All of us are treasured,
That's
unique
correct.
individuals with purpose in life. So, Dr. Wallach, let's go to the next hand that is up, and EA. Go ahead and unmute yourself. I know that you've been on with us before, and forgive me, I don't remember your first name.
Elizabeth.
Elizabeth, yes, welcome.
Uh-oh.
Uh-oh.
Okay.
Hi.
Yeah, Elizabeth, we'll come back to you, my dear. Let's go to Shelly Ann. Shelly Ann, go ahead and unmute yourself. So Shelly Ann says she's having bad headaches, Dr. Wallach.
Hello,
Hey.
hi.
Hi. How old are you,
Yeah.
Shelly Ann?
I'm sorry, did you say how old I am or how am I?
How old are you?
Oh, sorry, 48, going to be 49 September.
Okay, congratulations. Let's see here.
Thank
How much
you.
do you weigh?
Oh, gosh. In the 200s.
200 in the middle, 200 or low 200s?
Yeah.
Middle.
Yeah.
Okay. Okay. How tall are you?
I'm about 5'4".
Okay. At 5'4", I'd like to see you weigh maybe 130. So you might be 100 pounds or so overweight. So,
Mhm.
and you know, that Miss Rebecca, she lost 100 pounds. So we have, personal testimonies right here on the show.
I have disabled the chat.
Okay. You chatted. Okay. So how can we help you today? Other than the weight?
It's the headaches. I have terrible headaches.
Okay. Do you have any ringing in your ears?
No.
Do you have any balance problems or dizziness, anything like that?
No.
Okay. Do you have any dental problems?
No, I don't.
Okay. Let's see here. Has your voice changed and do you have any difficulty in swallowing?
No, I haven't.
Okay. And then I want to know, so your main complaint is weight. Is that correct?
No, my
And-
main
and the
complaint
headache.
is, yes.
Okay. Let's see here. Have you ever had Bell's palsy, where one side of your face droops?
No,
Have you ever had hiccups?
I've had, yes.
Do they last 20 seconds or half hour or what?
About a minute or so.
Okay. Do you have anything going on, for instance, like pain behind your eyes? When you say headaches, are they behind your eyes, your cheeks, or in the top of your head, the back of your head? Where are
No,
these headaches?
it will be the top of my head or towards the right side.
Okay. Trigeminal neuralgia can cause that. It's the fifth cranial nerve being squeezed by the skull. Okay. Also, Bell's palsy can cause that, which is a squeezing of the seventh cranial nerve, the facial nerve, by the skull, and you have osteoporosis of the skull. Do you have anything else going on in your knees, your hips?
The only thing that I've been noticing, well, I do have my knees, but I really think it has to do with my weight. But I've been having like a tremor in my left hand.
A tremor? Okay.
Yeah.
Okay. All
Like
righty.
sometimes I'll put
Mhm.
my left hand up to my breast if I'm drinking something, and then it just starts to shake.
Okay. Yeah, so it's a positional thing. Okay. How many
Yeah.
times do you wake up at night to urinate?
Oh gosh.
Once, 3 times, 5 times?
Maybe about two.
I'm sorry, I didn't get that.
About 2 times.
Okay, so 2 times, yeah. Okay. When you get up at night to urinate, that means that the nerves in your back are being squeezed by your skull. Your nerves in your spinal cord are being squeezed by your skull. And
Mhm.
those nerves are telling your urinary bladder to get up and go pee, okay?
Yeah.
Okay, now I know you don't have a prostate gland, so it cannot be a prostate gland because you're a girl, okay?
So sorry, not
Okay.
to interrupt, but I just wanted to also let you know that I've been also having frequent urinary tract infections. Why, I don't know.
Okay, now is this pain on urination?
Just discomfort and lower back and stomach pain.
Okay, yeah, so that goes along with getting up at night to urinate and all that kind of stuff. That's the same nerves in your back being squeezed. Okay, so here we go. None of the bad stuff. No fried foods, no air frying, deep frying, pan frying, none of the processed meats of any kind. Absolutely no oils, no cooking oils, no salad dressings, all that's got to go. No gluten, no wheat, no barley, rye, and oats. They got to go. There are no such things as gluten-free oats. If anybody tries to sell you gluten-free oats, call the police. Okay. And then let's see here. At 250 pounds, I want you to have one meal a day or a keto shake. One meal a day or a keto shake. Okay. That's not to be added to a meal. It's a meal replacer. And you can also use one or two of our drinks, the Rebound, with that. Okay, for energy and so forth. And you'll begin to lose a half a pound to 2 pounds a day when you use the when you use the keto shake. It comes in strawberry or chocolate flavor. And then I want you to take if finances are not an issue, I want you to take 3 Healthy Brain and Heart Packs a month, a full dose of breakfast, lunch, and dinner. If finances are a problem, do not go below 2 Healthy Brain and Heart Packs a month. Take a full dose of breakfast, a full dose of dinner. I also want you to have 2 bottles a month of our MSMs. You can take 3 at breakfast, 3 at lunch, 3 at dinner time. And they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc, vertebrae, vertebrae, bone makes bone itself, including the knee and the hip and all these other issues going on here. All right. And then I want you to, let's see here, also have the collagen peptides. Take a scoop of that with your morning drink. Take a scoop of that with your evening drink. Okay. And then I also want you to have our Beyond OsteoFX. Take 2 servings of that a day, 1 at breakfast, 1 at dinner time. If finances are not a problem, you could take 3 servings a day. I only weigh 142 and I take 2 servings a day with everything else of the Beyond OsteoFX. And then let's see here. I also, do you have no high blood pressure or diabetes?
I'm sorry, sorry?
Do you have high blood pressure or diabetes?
No, they said with the diabetes, I'm borderline. High blood pressure, no. My doctor says, if anything, it's more on the lower side.
Okay, good. All right, well, just, you can go to a pharmacy without a prescription and get the test strips, you dip in a urine sample, or you can stick your finger and take a drop of blood. They only, it's like $1.35 a piece. I think they come in small bottles, like 3 in a bottle kind of thing. And, test yourself. And if it looks like your blood sugar is starting to go up, get our sweeties and take 3 of those twice a day. And that can reverse type 2 diabetes. Okay. It'll get your blood sugar under control. You ever get drowsy after you eat? You eat a big meal and then half hour later you get sleepy?
Yes.
Yeah. Okay. That's called reactive hypoglycemia. And so do not drive after you eat, because you'll fall asleep and cross the center line and kill somebody.
Yeah.
You hear about all these people crossing the center line and doing head-on collisions and dying. That's because they had what you got. It's called, reactive hypoglycemia, because you're eating a big meal and then, or a high carbohydrate meal, and your body releases a lot of insulin, and it just knocks your blood sugar down. And that's what's going on here. So you got all these things going on. And so, this is not difficult. You just have to be consistent. Okay.
Right.
And every one of these issues will go away. And again, if you get on that 1 keto drink per day, on the weekends, if you want to, you could pick one day, Saturday or Sunday. It doesn't have to be the same day every weekend. It could be Saturday one weekend, Sunday 2 weekends in a row, and then back Saturday. But one day on the weekend, have 2 meals a day as a keto diet. But during the week, when you have things to do and so traveling around, just have 1 keto meal. Okay. Remember, these are not add-ons. These are meal replacers. Now, the record for women in the weight department is 1,200 pounds. The record for men when it comes to being overweight is 1,400 pounds. You do not want to keep going in that direction. Okay, back to you, Rebecca.
All right. Thank you, Shelly Ann. So Dr. Wallach, next let's go to another question that we had come in from Hilda. Oh, wait, Elizabeth is back. Elizabeth, go ahead and unmute yourself.
Okay.
Live with Dr. Wallach.
Hi, Dr. Wallach. I'm
Hi.
trying to find out anything that I can about, my mom had AMD. That's, with your eyes where your macula clouds up and you can go blind eventually. A lot of people are getting that these days. And I didn't know how she got it, but I wrote a book. She didn't get it till she was older, but she died at 100. But
Well, that's pretty good.
they said that if you take, because I started first, I was nearsighted at age 14, 11, and with astigmatism. Okay, so I've had that my whole life. I started taking this fermented cod liver oil they suggested to help your eyes. And all of a sudden, I am not nearsighted anymore. I don't need my contacts at all. I don't wear them. I can see just as well without them. I see very well now. I don't need any glasses. But now, I used to be able to see really well close up. I was a phlebotomist. Now, it's hard for me to read things close up now. I don't know
Okay.
how this happened. It's like,
Okay, well, are you still using that cod liver oil?
yeah, I'm going to take it because I've got to keep from getting that disease.
No, because cod liver oil is oil. Remember I said no oils. And it oxidizes and turns into trans fats. It causes plugging of the arteries in the eye and every place else. And when you have macular degeneration, the macula is the back of the eyeball where the optic nerve goes into the back of the eye, and the tissue in the retina around that macula is very high in cells that detect the light and also color and all that kind of stuff. And so you got a little temporary benefit there, but chronic use of oils causes you to have now macular degeneration, and will cause you to go blind. Okay, so you got to stop that. Remember, I said no oils. And so, how much do you weigh?
About 140. I'm 5'5", and I weigh 173 now.
And you're 40.
I'm 73, but I weigh 140.
Well, you weigh 140 because you said you weigh 173.
Well, I'm 73 years old.
Oh, okay.
But I weigh 140.
Okay. And you're 5'5". Okay. So what I want you to do is get rid of all the bad stuff. Again, no fried foods, no air frying, no deep frying, no pan frying, no processed meats of any kind, no bologna, salami, pastrami, pepperoni, jerky, carby, spam, absolutely no bacon, no ham, none of that kind of stuff. No oils of any kind, no oils of any kind, no oils of any kind. And then absolutely no gluten, no wheat, no butter, rye, and oats. There are no such things as gluten-free oats. Absolutely, excuse me, no sugar, and then absolutely no carbonated drinks. Even the diet one's got to go because the carbonation neutralizes the stomach acid, so you cannot efficiently absorb minerals and digest food. So here we go. At 140 pounds, I want you to take 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. Remember, none of the bad foods. We went over that. Then 2 healthy brain and heart packs per month, photosynthetizing twice a day. 2 bottles a month of the MSM, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time. And they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between vertebrae, bone makes bone itself, including bone marrow, and repair the skull. But it wouldn't hurt for you to get that book. It's all in your head. It goes into the great detail of why these 12 pairs of cranial nerves and the spinal cord get impacted when you have osteoporosis of the skull. Then I see here, I also want you to take, let's see here, the anti-inflammatory. I want you to take the Z radical. You go ahead and it's a liquid. You can take, as your body weight, you can start out with a ½ ounce twice a day. It's 1 quart a month. It's made from seaweed and all that kind of stuff. If you prefer the capsules, you can take the Fucoid Z, take 3 those twice a day. That's 2 bottles a month of the Fucoid Z. It's the same thing that's in the Z radical, it's just a capsule form. And so that's kind of the direction I would go. And, give us a call every couple of weeks because macular degeneration turns around very quickly. But you got to stop the bad foods because that's what's causing this, including the oils. No oils. Okay?
Okay, thank you.
Okay, bye-bye.
Bye-bye.
All right, thank you, Elizabeth. Now, Dr. Wallach.
Yes, ma'am. I am here.
Another question coming in from Hilda. in regards to her friend Teresa, or Theresa, age 89. We don't have a weight or height, but the things that she is experiencing are, she's diabetic, she has vision issues, she has hypertension, she's on dialysis, and they're thinking she may be starting to be delusional, where she sees faces looking at her. Is it too late? Is it ever too late to start a nutritional program?
Oh, absolutely not. Absolutely not.
So share with us, Dr. Wallach, what you would do in order to help Theresa.
Okay, I'm going to answer your first question, and then I'll answer the second question. We have a CD and a DVD set called Praise the Lord and Pass the 90. It's actually a pastor, Mike Freeman, up in Baltimore, Maryland. He was in Johns Hopkins Hospital in a coma for 6 months, and the doctors called his wife and said, look, he's only got hours or maximum a day or two left to live. If you want to see him while he's still alive, you better get here now. And so she and one of our great distributors up there in the East Coast, Miss Linda, and they called me and said, is there anything we can do for him? He's been in a coma for 6 months. They say, oh, they got hours or days to live. So, well, does he have a G tube so we can put stuff in there? No. Okay, well, just take our plant minerals, our liquid plant minerals, and put a cupful on his chest and a cupful on his belly 2 or 3 times a day, and then do it on his back, between his shoulder blades and his lower back 2 or 3 times a day. Again, a cupful of plant minerals. In 3 days' time, as God is my witness, Pastor Mike Freeman wakes up, shaves, goes back to his TV studio and his radio studio at his church, starts telling the world his story, and they call me and tell me the story. So I flew up there and we did an interview. We made a tool out of it, a CD and a DVD called Praise the Lord and Pass the 90. And if you were in the military, you'd know what that meant, because in the military, when you're in the middle of a battle and the enemy's shooting at you and throwing hand grenades at you and everything, you want the God to be on your side, absolutely. But you also want to have enough ammunition to shoot back at them. So it's Praise the Lord and Pass the ammunition. So that's why we came up with Praise the Lord and Pass the 90 in that case. And here's a case where this sort of thing will help also here for this handful of things that are going on. Okay. And I guess it's Teresa's mom, right? So she's getting rid of all the bad foods: no fried foods, no processed meats, no oils, no glutens, no wheat, rye, no sugar, no carbonated drinks. And then let's see here. She weighs,
We don't have a weight, so let's go
okay.
by 100 pounds.
Okay, well, let's say per 100 pounds of body weight, she needs 1 healthy brain and heart pack per month, and divided in, equal doses depending on how many she needs to get. Then she needs MSM. At minimum, she needs 1 bottle a month of MSM, so you can take 3 twice a day. Better yet, your finances are not an issue. Get 2 bottles a month, so you can take 3 at breakfast, 3 at lunch, or dinner time. I only weigh 142, and that's what I do. Okay, and then I also want her, because she got diabetes, I want her to get 2 bottles a month of her sweeties. Don't cold turkey off the medication, but get her on 3 sweeties twice a day. And as her blood sugar begins to come down, you can slowly reduce the medication. Usually within 2 to 6 weeks, she'll be an ex-diabetic, even at her age. And then, let's see here, high blood pressure. She needs and this will also help with the dialysis, okay? And you don't know if she's on dialysis 3 days a week or 6 days a week, but let's just say we're going to give her per 100 pounds of body weight, 2 bottles a month of the Ultimate Daily Classic tablets. So you take 3 at breakfast, 3 at dinner time, and 3 at lunchtime. Okay. And that's going to support and promote maintenance repair of her arteries, the high blood pressure. It'll support healthy blood flow going through blocked arteries and support healthy blood pressure. Also, it'll gradually reduce the need for dialysis. I take people that haven't urinated in 10 years or on dialysis 6 days a week, and on this program we just laid out, they'll drop from 6 days a week of dialysis down to 3 days a week. And in 2 more weeks, they're totally off of dialysis after 25 years of being on dialysis and 10 years of being on dialysis 6 days a week and not urinating. This is all very simple stuff. Okay. Well, the delirium stuff, you need to have 3 eggs twice a day. It may have a little bit of MS going on in there also. These 3 eggs twice a day with soft yolks, not hard boiled, none of that, but it needs to be soft yolks. I like mine soft scrambled in butter. and liquidy, but also soft boiled, soft yolks, soft poached, soft yolks. And then let's see here. I think that's where we want to go. Again, I would go, wouldn't hurt to throw in the memory FX, get 2 bottles a month of the memory FX, so she can take 3 at breakfast, 3 at dinner time, even at 100 pounds. And then give us a call every 2 weeks and let us know how she's doing. And, you know, we need to know everything from the blood sugar, how about pressure, the dialysis, behavior, all this stuff. And so we'll be looking forward to hearing the story.
All right. Thank you so much, Dr. Wallach. And again, everybody, you can get the replay of this program so that you can go back and listen and rewind and stop while you're writing it down and getting exactly what Dr. Wallach is recommending for a nutritional protocol to assist the body in being able to fight back against these conditions that are going on within, no matter what the age is. Now, Dr. Wallach, Theresa is on with us, but she says she's working, so she can't unmute. She just started the Healthy Body Pack with plant-derived minerals. She wants to know what else can she do to get her asthma under control. She is a gluten-free, grain-free, dairy-free household. She's 49, 5'1", and 140 pounds.
Okay, and her main question is asthma.
Asthma, that's right.
Okay, well, asthma is a nutritional deficiency disease. It could be misdiagnosed. It could be also due to indirectly a nutritional deficiency disease. It could be osteoporosis, squeezing the 10th cranial nerve, and it really is COPD and not asthma, but maybe it is asthma. And that's also caused by nutritional deficiency of a class of nutrients. People say, which one is it? Which one is it? Well, I used to tell people what it was, and they would run out and buy that one nutrient. And in 3 months' time, they're dead because they only took one nutrient. They were 89 short, and the other deficiencies killed them. Okay. So I stopped telling people what nutrient that is. But if you get the book, Epigenetics, you get the book, Dead Doctors Don't Lie, you get the book, let's see, Let's Play Doctor, Let's Play Herbal Doctor, Password Aromatherapy, it'll give you a good clue. It wouldn't hurt also to get a hair analysis. Okay, at 49 years old, if there's these deficiencies, there may be more deficiencies going on there, and they haven't quite manifested themselves yet. So it's a good idea to, you know, once or twice in your lifetime, get a hair analysis, see what's going on. It'll tell you the essential nutrients and minerals as well as the toxic minerals. There's 2 different charts, very useful information. But let's just say for the asthma, we're 140 pounds. We're going to get rid of all the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, butter, rye, oats, no sugar, no carbonated drinks. Yeah, it's chapter 10 in that book. Chapter 10, it'll tell you how to collect let's see here, rare earths and cures. It tells you how to collect the hair, where to send it. Don't forget to put the check in with the sample, because if you don't put the check in there, the laboratory won't run the test without the check, so sort of thing. But 2 healthy brain and heart packs a month, full dose thing twice a day. MSM, 3 of those, 3 times a day. There's 2 bottles a month to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between a vertebrae, bone makes bone cell. And then the collagen peptides, a scoop of that with a morning drink, a scoop of that with the evening drink. Also, I'd take the Beyond Osteo FX. It comes in liquid, powder, and capsules, however you want to take it, 2 servings a day. And then vitamin D3, take 3 of those twice a day to maximize absorption of all these nutrients, and particularly the minerals. And you just can't get these things by just eating well, because plants do not manufacture minerals. Nutritional minerals do not occur in a uniform blank around the crust of the earth. They occur in veins like gold and silver. So the only way you can guarantee you're going to get all these essential factors is to put them in your mouth. Okay, that's why we came up with the systems we have. But asthma goes away very quickly. Remember, right now in America, the cost of just treating symptoms of asthma in kids under the age of 10 in the United States is 80. Let's see here. It's 80 million. No, I take that back. It's 80 billion. $80 billion a year just to treat the asthma in kids under the age of 10 in America, just to treat the symptoms, not to prevent it, not to cure it. $80 billion a year. It's a very expensive disease that can be deadly, but certainly it's easily prevented and easily reversed because it's a simple nutritional deficiency disease. There you go.
All right, Dr. Wallach, thank you so much for all the information that you are sharing. Now I have an email coming in from Sharon. Sharon is 56 years old. She is 168 pounds at 5'9". She is currently taking the Tinky Tangerine tablets and sweeties with meals. But she says, my cholesterol is still very high, blood sugar high too. My doctor wants to put me on statins and I don't want to. What else should I do? I know I don't get enough exercise and I can eat better, but I need some guidance. Oh, and I'm still battling with hot flashes for the last 6 years.
Okay. Well, first of all, she's making a common mistake in taking the BTT tablets. BTT tablets are not to replace the BTT powder. The BTT powder is vitamins and minerals. The BTT tablets are designed to reduce inflammation and pain and to support the immune system. So it's okay, she can continue to take those BTT tablets, but she's got to take the BTT 2.0 powder, okay, which is the vitamins and minerals. She's missing that. That's one of the main problems. And then at 168 pounds, let's see here, she needs to take 3 eggs twice a day. That's going to help with the hot flashes, as well as the other things going on in her life. Okay. She needs to take 3 of the eggs with soft yolks, soft boiled, soft yolks, soft poached, soft yolks, soft scrambled butter, not fried, not hard boiled. And then she also needs to take the MSM, 2 bottles a month there. So you can take 3 with each meal. That'll support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makes bone itself. And then the collagen peptides, scuba that with morning breakfast, scuba that morning drink, and scuba that with her evening drink. And then because of the hot flashes, the eggs are going to help, but she also needs the Xerafem. Get 2 bottles of Xerafem, so you can take 3 at breakfast, 3 at lunch, or 3 at breakfast, 3 at dinner time. Okay, 3 twice a day. And that's going to give her ovaries what the ovaries need to continue making some female hormones. Okay. And so let's go that direction, and then call us every couple of weeks, because this is a very common scenario, very common. And that's because doctors give a lot of misinformation to these women, you know, at that age where they're going to go and starting to go through menopause, and they don't get, you know, it's essentially MS of the ovaries is what's happening there. Multiple sclerosis of the ovaries is what's happening here, because she's not getting the right stuff. She's taking the BTT tablets instead of the BTT powder. Now I take both. But if she wants to continue taking the tablets, that's fine, because it'll relieve inflammation and pain and all that kind of stuff, support the immune system. But she needs to also get and that's why I always say the Healthy Brain and Heart Pack. I always say the Healthy Brain and Heart Pack, because the Healthy Brain and Heart Pack gives you the 215 nutrients, including the basic 90. Okay, 215 nutrients in the Healthy Brain and Heart Pack. When you have things that are really disruptive in your life, things that are life-threatening, things that are disruptive to your lifestyle, why would you want anything less than 215 nutrients that you cannot get from your food? Okay, back over to you, Rebecca.
All right, thank you so much, Dr. Wallach. And just a reminder to everybody that if anything in this program catches your eye and you want more information about it, make sure that you get with the person that shared this program with you, because they cared enough and they have their own special way to get the products that Dr. Wallach is recommending. So get with them. Dr. Wallach, we have 2 hands and 9 minutes to go. So let's see
Okay.
what we can do.
Okay.
Let's go to Danielle. Danielle, go ahead and unmute yourself. If you're able to come live on camera, that would be fantastic.
Hi, good morning. Thank you for
Hi.
taking my call.
How can we help you?
Okay, so something I've been struggling with for the last 5 years is I started to get some hyperpigmentation on my face, mainly on my upper lip and kind of in the T-zone around my face. And I've tried everything and nothing's taking it away. And I see a nutritionist who's also told me that I have like a borderline underactive thyroid and fatty liver. So I do get a lot of headaches. I have a lot of issues with weight gain, and I struggle to lose weight. I would say that
So
those are
how much you weigh?
175 and I'm 5'2".
Yeah, 5'2". I'd like to see you weigh maybe 110, 120. So you might be 50 pounds overweight. You need to have one meal a day or a keto shake. 1 meal a day or a keto shake. It's not to add on to a meal. It's a meal replacer. It does not have to be the same meal every day. In addition to that one keto shake a day, you also want to take, say, 2 servings of a Rebound. If you're going to use the cans, you got to leave it and pop it open and leave it off gas the CO2 for a couple hours. Or if you want the sticks or the canister of powder, okay, the Rebound.
Okay.
Remember that the just remember that this the weight loss stuff is a thing that has to be taken without all the other bad foods. No fried foods, no processed meats, no oils, no gluten, no wheat, bread, around oats. And then the pigment thing, I would go with the hair, skin, and nails. Do you color your hair? Do you have a little bit of gray in your hair?
Yes, I'm actually starting to get quite a bit of gray hairs.
Okay, you need the hair, skin, and nails. Take 3 of those twice a day. It'd be 2 bottles a month. Don't forget the MSM, 3 of those with each meal. That's 2 bottles a month. You need the collagen peptides, a scoop of that with breakfast, scoop of that with dinner. And because you have a little thing going on with the thyroid, I'd get the Ocean's Gold. Take 3 of those twice a day. That's 2 bottles a month. Okay, and that's going to cover the waterfront. Okay.
Okay. All right.
So that'll take care of the hair color and also the skin issue.
What do you think is causing that?
You're nutritionally
hyperpigmentation?
deficient. You're nutritionally deficient.
All right.
Okay.
All right. Thank you, doctor. Appreciate
You
it.
bet. Call us every 2 weeks.
I will actually. I'll let
Don't
you know what's going
yeah.
on.
I want to know what your weight is. Don't forget the keto shake. Okay.
Okay. Will do. Thank you.
Mm-hmm.
All right.
Okay,
thank
we
you,
got time for one
Danielle.
more.
Yep, I think we have 6 minutes. We have time for one more.
Oh yeah.
Bruce, go ahead and unmute yourself, my friend. You're on live with Dr. Wallach.
Hi, Dr. Wallach.
Yes, sir.
Thanks for
We got to go
taking-
quick.
Okay, my friends are coming down with the COVID, so they got high fever. And,
Hey, 1 minute, Bruce. Your finger is over your microphone.
oh, sorry.
There we go.
Oh, yeah, I got some friends, a number of friends that are coming down with the COVID, and they have like high fever and chills. And I was telling them to, use more supplements like vitamin C and D3.
They need more than that. They need the Healthy Brain and Heart Pack. They need the 215 nutrients. They need the collagen peptides to support their bone marrow, which is their immune system. They need the BTT 2.0 tablets to support the immune system. Okay. And they need the colloidal silver, 2 droppers full under their tongue 30 minutes before each meal, 2 droppers under their tongue before bedtime. And it's important to take all these nutrients. You just can't take vitamin C. That's very, very dangerous because it gives them a false sense of security. And they're an 89 chart. Okay. You can't just take vitamin C. Vitamin C is good for scurvy. Okay.
Okay.
All right. And so it's one of those things where it's very, very important to take the whole package, and then they're going to get the benefit they're looking for. The reason why they're having a spike here is because so many people are vaccinated, which is not a bad thing, but you still have to take your 90 essential nutrients to be able to respond when the bad guy shows up, because vaccines do not kill the virus. Vaccines do not kill the virus. Vaccines do not kill the virus. Vaccines alert your immune system to the bad DNA and RNA in the virus. So when the virus shows up, your immune system knows to react, send out the cavalry, send out the Marines, the white blood cells and the antibodies and all that kind of stuff, and to kill and eat the virus. Well, if you're not getting the 90 essential nutrients, you can take all the vaccinations you want, but you're not going to be able to respond. And that's what's happening here.
Okay. All right. Thank you very much, Dr. Wallach.
Yes, sir. God bless, Bruce.
You too.
All right. Thank you, Bruce. Well, Dr. Wallach, I would just want to thank you. And I want to thank My co-hosts, you wouldn't know what an amazing day we had today. And amazing is amazingly wonderful, amazingly sometimes difficult. I can't even get them up on screen. Help, Ruth Ellen. So yeah, it was quite the day, and the information that you shared was not interrupted. And we just want to thank everybody for joining us today. Make sure that you reach out to the person that shared this program with you.
A lot of people need to listen to this one.
A lot of people do. We covered a lot of different things, Dr. Wallach, and we went in depth on many of them. And understanding, when you have knowledge, you're able to understand. When you're able to understand, you're able to more easily, is that right? Come on, Jonty, more easily.
Yes.
Yeah, he's my grammar guy. Make the changes that are needed, that are going to be most beneficial, and making sure that you are able to obtain your health goals and reach your optimal self when it comes with health. And when you're working on your health and you're feeling great, then your mind is doing better. You're emotionally better. You're able to make better choices all around. Everything is connected. And I love the fact, Dr. Wallach, that we are able to provide a huge part of that connection when it comes to life. And it's all because you never quit. And you still aren't quitting.
And the team, and the team. And the team.
Yes.
Can't forget the team.
Oh no, I will never forget my team, even especially after today. But it is just such an honor to be able to host this program. And as I started to say, if you were not referred to anybody by this program, by anybody specific, and you would like to speak with somebody, or you know exactly what you want to order because Dr. Wallach told you, we do have a call team standing by at 855-949-7234, or you can reply to that email that you received from being part of our Critical Health News newsletter. Just reply to that. One of our certified holistic health coaches will get back to you. We do have a very high volume because so many people, Dr. Wallach, are waking up and realizing there's something broken, something needs to change, and they're seeking solutions. And that's one thing, Dr. Wallach, that we are here offering, because there is hope beyond the chemical solutions. Thank you, Dr. Wallach. Again, thank you to my team, Heather Bowen, Dr. Judy Reynolds, Ruth Ellen Sanchez, John T. McCollier, Nasima Omar, everybody. You've been watching Ask Doc Live. Go to AskDocLive.com to get Dr. Wallach's Good Foods, Bad Foods list. And again, all of our replays and Dr. Wallach's most popular books. Bye for now.
Love you guys.
Love you too, Dr. Wallach.